April is Autism Acceptance Month. The autism spectrum has a range of conditions impacting how a person behaves, communicates, interacts, and learns.
And Dr. Aubyn Stahmer, a professor and clinical psychologist at the UC Davis Mind Institute, is joining us live to talk more about this afternoon. Thank you so much for your time. First of all, just tell us about how common autism is today.
We see autism, we see autism about 1 in 44 children have a diagnosis, and it's more prevalent in boys than in girls. So 4 boys for every girl that's identified with autism.
All right, so what does autism look like in a child, and what are the characteristics?
Yeah, usually parents come in for an evaluation because their child isn't speaking or is using language in an unusual way, not able to ask for the things they need or tell us what's frustrating and what's not. Their play might be a little different. They might prefer to play on their own, or they might play in an unusual way with toys. And then things in the environment might bother them, like bright lights or sounds or particular textures, things like that. Those are the kind of early things we look for to determine if someone might have some symptoms or signs of autism.
So talk us through the official diagnosis process then when a child is brought in, and what age is that diagnosis usually made?
So we can make a diagnosis as early as 18 months to 2. Oftentimes kids are 4 or 5 before it gets recognized when they get to school. So we like to identify autism early so we can start intervention like you see in the picture here, so kids can really learn to talk and learn from their environment. And so there's no blood test for autism. We bring kids in and we do a series of what seems to them like play activities to see how they're using language, how they're responding when we call their name, or how they play with toys and interact with other people. And those behaviors help tell us whether autism is a concern.
We're talking about early intervention. We're talking about young children, but how late in life can somebody be diagnosed with it? And then once somebody is diagnosed, what interventions are available?
Yeah, so you can be diagnosed at any time. Sometimes we'll have parents bring their children in for an evaluation and say, I have a lot of these same things happening with me, these same characteristics. Maybe I have autism too, especially if the characteristics haven't interrupted getting a job or things like that, but they'll notice that that's happening. And so the interventions, we have a kind of set of evidence-based interventions, and they might be, which one you use will depend on what the specific needs of the person are, how old they are, what kinds of social skills they want to learn, or what kinds of language or communication they need to learn. Some individuals might use a communication device, for example. So the intervention will depend on the needs of the person, which is really varied.
Yeah. All right. Some important insight for us. Dr. Aubyn Stahmer, thanks so much for your time this afternoon.
Thank you.